everyone, we are from the SP12. Today, we are going to discuss about infertility for subject anatomy and physiology. What do you guys know about infertility? Let's check it out. But before that, let's introduce our group members. So guys, what is infertility?
What is infertility and why is it a big problem right now? For example, even in the literature, there are several attempts to define infertility by clinical, epidemiological and demographic, but all stand in disagreement with each other. WHO revised glossary by 2009 defined infertility as a disease of the reproductive system defined by the failure to achieve a clinical pregnancy after 12 months or more of regular unprotected sexual intercourse. At the moment, Malaysia face fertility rate drop from 4.9 children per woman to 1.7 in 2021. This shows that infertility has been growing in Malaysia and there must be a several factor behind it.
The chart shows the fertility rate in Malaysia from 1915 to 2024. The current fertility rate for Malaysia in 2024 is 1.910 birth per woman, a 0.73% decline from 2023 and decrease from past 4 years. Do you guys know what is the factor of infertility? Come and let's see.
Causes of infertility. Firstly, impacts of diet and exercise. For example, being overweight can affect one's fertility. Being underweight and having extremely low amounts of body fat are associated with ovarian dysfunction and infertility. Secondly, psychological effects. As we know, stress is a prominent part of any society, whether it is physical, social, or psychological. For example, death has been issued that living costs in Malaysia getting higher and couples decided to limit themselves of bearing a child. Thirdly, substance consuming. For example, cigarette smoking, drugs, alcohol, and caffeine. The negative effects that are emphasized in recent research are miscarriage, spontaneous abortion, fatal death, and stillbirth. Lastly, clothing. The type of clothing a man chooses to wear may have effects on reproductive health. There have been studies that have found significantly higher temperature with tight-fitting clothing versus loose-fitting or no clothing. In another study, men who wore tight-fitting underwear and pants had a relative risk of 2.5 of having impaired semen quality.
So, how can we treat infertility?
In vitro fertilization. In vitro fertilization or IVF is one of known types of assisted reproductive technology. IVF is a medical procedure used to help individuals or couple conceive a child when they are experiencing infertility or certain medical condition that make natural conception difficult. IVF works by using a combination of medicine and surgical procedure to help sperm fertilize an egg and help the fertilized egg implant in your uterus. IVF has advanced significantly over the years, offering hope and successful outcome to many who face fertility challenges. Each step of the process is carefully managed by a team of fertility specialists to maximize the chances of achieving a healthy pregnancy. On average, you can expect the process to last 4 to 6 weeks. This includes the time before egg retrieval, when a person takes fertility medication until they are tested for pregnancy. Approximately 5% of couples with infertility will try IVF. More than 8 million babies have been born from IVF since 1978. It's one of the most effective assisted reproductive technologies available. First of all, birth control pill. Individual may be provided with birth control pill or estrogen by the doctor. Second, ovarian stimulation. Individual will be injected with hormone medication to make the egg fully matured. Third, egg retrieval. Eggs being taken outside from vagina into special solution. Fourth, fertilization. Embryologists will fertilize all of the matured egg using ICSI. Embryo development. Embryo must overcome significant hurdle for transfer to uterus. 6. Embryo transfer. When uterus ready, embryo will be transferred. 7. Pregnancy. Pregnancy occurs when embryo implant itself into lining of your uterus.
Fertility treatment in Islamic perspective.
Quranic verse regarding IVF. A'udzu billahi minasy syaithanir rajim. Lillahi mulkus samawati wal ard. Yakhluqu ma yasha'. Yahabu liman yasha'u inathan wa yahabu liman yasha'u dhukur. أو يزوجهم ذكرانا وإناثا ويجعل من يشاء عقيما إنه عليم قدير. صدق الله العظيم. The dominion of the heavens and the earth belongs to Allah. He creates whatever He please. He grants female to whomever He please, and males to whomever He please, or grants them a mix of males and females, and causes whomever He please to be barren. He is all-knowing, all-powerful. This Quranic verse explains that it is human nature to have children, but infertility prevents many from doing so. Being infertile is not a choice and does not diminish a person's worth as a man or woman. Therefore, it is essential for those who are infertile to seek treatments for infertility, such as IVF. Fatwa regarding IVF. Fifth Mudzakarah of Fatwa Committee of National Council for Malaysia Islamic Religious Affairs meeting convened on 16 to 17 November 1982, and the 6th Mudzakarah of the Fatwa Committee of National Council convened on 10 October 1983 discussed the test tube babies. Mudzakarah has decided that, first, test tube baby from the semen of the husband and wife which then is fertilized respectively is valid in Islam. Consequently, if the semen and ovum is taken from someone else other than a husband and a wife is invalid. Second, it is permissible for babies born through the help of medical intervention to be a wali and has a right to accept inheritance from their family members. Third, if the semen and ovum from a husband and wife is obtained through means that does not contradict with teaching of Islam, then it is considered as a respectable means.
How can we increase fertility rate in Malaysia?
Now, let's take a look how to increase fertility from individual side. First, practicing a healthy lifestyle in daily life by taking a balanced diet which follow quarter health that's suggested from Ministry of Health. As we know, overweight and obese women have higher level of hormone called leptin, which is produced in fatty acid. This can disrupt the hormone balance and lead to reduced fertility. Second, avoid from taking smoke. Smoking has been shown that have negative effect on fertility. According to research finding, menopause occurs on average 1 to 4 years earlier in female smokers than in non-smokers. This indicates that smoking accelerates the rate of depletion of the follicular apparatus of the ovaries. Although the smokers are diagnosed with reduced sperm count, reduced mobility and morphology. Apart from that, government side can lowering costs for treatment to help schools to have their own children. Like on 16 November 2023, our Economy Minister Rafizi Ramli has announced to increase government investment in reproductive health services to counter declining birth rate as the nation population ages, with RM170 million earmarked for the National Sub-Fertility Centres in Shah Alam Selangor. Other than that, government can also provide sub-fertility services from Lembaga Penduduk dan Pembangunan Keluarga (LPPKN). The setting of this clinic is one of the initiative of the National Population and Family Development Board
LPPKN to overcome the problem of female and male fertility in the country by adding the sub-fertility clinics offer IUI, IVF and ICSI services. Government's objective of helping couples, especially for those in the M40 and B40 groups, to deal with the problem of infertility through the LPPKN sub-fertility service have been achieved.
The IVF procedure involves several steps. First, follicle aspiration occurs where eggs are harvested from the ovaries using a needle guided by ultrasound, and a suction device collects the eggs from follicles. Next, in the fertilization stage, collected eggs are fertilized either by insemination or by intracytoplasmic sperm injection. Fertilized eggs, or embryos, are then monitored for growth, and some may undergo assisted hatching to aid implantation. Finally, embryo transfer takes place where hatched embryos are transferred into the uterus using a catheter inserted through the cervix.
Through this study, it shows that decreasing fertility rates does not only impact family size, it also reduces population growth, which accelerates the country course towards aging nations. As we know, many spouses face difficulty to have their own children due to infertility. There are lots of treatments that are available in Malaysia, such as IVF and IUI. There are many factors that causes infertility, like psychological effect and unhealthy diet. Besides that, every problem could be solved by applying a healthy lifestyle in our daily life. Initiative government can also help spouses to having children by lowering costs for the children. Last but not least, everyone should unite to help spouses in need to have their own children.
That's all from us. Thank you. Before that, I would like to quote a word from Nelson Mandela. Children are the most important asset in a country. For them to become the asset, they must receive education and love from their parents.